Good afternoon, everyone. Today's topic is antidepressants, and depression is believed to be because of the monoamine theory, that is the lack of the one of the neurotransmitters, serotonin, norepinephrine, or dopamine in central nervous system. There is another theory that is also caused by the depletion of the these amines because of the regulating genes. So both of these theories are not completely understood yet, and they will not explain the depression development completely, but can be used to understand the mechanism of action of the drugs that are used for the treatment of the um, depression. The primary group for the treatment of the depression is the selective serotonin reuptake inhibitors. So the mechanism of action of this drug is based on the blocking the uh, reuptake of the monoamines, including serotonin, that will increase the concentration of the serotonin in the synaptic cleft, and that will increase the uh, activation of the serotonin receptors, or 5-hydroxytryptamine receptors, that is another name for the serotonin. This group of drugs include citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, and sertraline. Selective serotonin reuptake inhibitors are a most commonly used antidepressants, including the fluoxetine, that is the cheapest antidepressant available on the day, and these drugs have uh, minimum adverse effects and uh, can be used for the chronic treatment for a long time, and also can have less interactions with other drugs and food. The next group is selective norepinephrine reuptake inhibitors, and this group includes venlafaxine, desvenlafaxine, duloxetine, and levetiracetam. So this group of the drugs inhibits the uptake of norepinephrine, and that's why increases the uh, epinephrine concentration, norepinephrine concentration in the synaptic cleft in the central nervous system, and that activates beta and alpha 1 central receptors that will lead to the decrease in the depression. However, because of the increase in the norepinephrine, this group of the drug have more adverse effects because of the stimulating the heart, and that lead to the um, some heart diseases because of the overstimulation. The next group is tricyclic antidepressants. Tricyclic antidepressants have both uh, inhibition to of uptake for serotonin and norepinephrine, and that is why they uh, have um, like larger uh, indications, and the tricyclic antidepressants name is based because named because of the chemical structure of they consist from the three cycles, and The primary antidepressant here is amitriptyline. Then the uh, amoxapine and clomipramine, desipramine, doxepin, imipramine, maprotilene, natriotylene, and propylene. So these are the, and also this imipramine. This imipramine is more selective for the uh, norepinephrine reuptake inhibitor. Uh, and the because this group of the drug will also block other receptors rather than serotonin uptake and norepinephrine uptake. They also block adrenergic alpha receptors and muscarinic receptors and also histaminic receptors that leads to the many adverse effects, including the uh, sleepiness for the because of the histamine blocking of histaminic receptors, elevation of the blood pressure because of the alpha receptors, and uh, antimuscarinic adverse effects, including the dry mouth, constipation, and blurred vision. Uh, they also can lead to the arrhythmia uh, because of the blocking the alpha uh, adrenergic receptors. Some of these drugs have additional indications. For example, doxepin can be used for the sleeping disorders, and uh, also nortriptyline can be used for the some pain relief. The next group is monoamino oxidase inhibitors. This group of drugs is uh, inhibiting the monoamino oxidase that will uh, prevent uh, the metabolism of the neurotransmitters, including the serotonin and uh, norepinephrine in the central nervous system. So that will increase the concentration of the of these neurotransmitters in the synaptic vesicles, and further uh, more is released to the synaptic nerve. However, because they block monoamino oxidase non-selectively, they also block monoamino oxidase in the gut, and that will increase the absorption of the tyramine from the food, and potentially increase uh, the tyrosine, uh, okay, increase the tyrosine that will further increase the uh, norepinephrine storage, and that may lead to the hypertensive crisis. So these adverse reactions and others and interaction with the food, that is the incompatibility with the tyrosine containing tyramine containing food, that includes cheese and smoked uh, of food, fish, and also wine, that makes the monoamino oxidase inhibitors uh, with uh, less commonly used, like isocarboxazide and phenelazine, renylcipramine, and also siligyline is used for the treatment of the Parkinson's disease because it more selectively blocks monoamino oxidase type B that decreases that metabolize the dopamine that lacks in the Parkinson's disease. And monoamino oxidase A is more selective for the serotonin, and that is why most of the monoamino oxidase inhibitors will block preferably monoamino oxidase A than B. So because these antidepressants cannot be combined with the other antidepressants, and 2 weeks window should be taken between switching to and from these antidepressants. This group of drugs is less commonly used and only when other antidepressants are non-effective. And the last group is an atypical depressants. Atypical depressants have different mechanisms of action, and for example bupropion is inhibitor of the monoamino oxidase type B that decreases the reuptake the inhibits the reuptake of the norepinephrine. Then the mirtazapine is blocking the histaminic and adrenergic alpha 2 receptors that are presynaptic, and that is why, and also serotonin receptors blocker, that is why it's good as a sleeping agent and has the adverse effects of the sleepiness. The trazodone and nefazodone inhibit reuptake of the serotonin and also block alpha 1 and serotonin receptors and also histaminic receptors, and also lead to the sleepiness as adverse effect. Then volizodone is blocking the reuptake of serotonin and also activating the serotonin receptor. And vortioxetine is blocking and activating serotonin receptor and blocking the uptake of serotonin as well. So the last mechanism of LOX1 is not completely understood yet. So these are the antidepressants. The selection of the antidepressants usually depends on the patient compliance and adverse effects, because neither of the groups is more effective for the treatment of depression that is another one. Thank you for your attention and see you next week.